These nurses are staging a protest in front of their hospital in response to a decision to re-sterilize used face masks instead of disposing them after a single use as they normally would.
The feeling of dread that we are going to get infected with COVID-19, that we're going to take it home to our family members and infect our vulnerable aged parents, children, spouses. The fact that I have to reuse a mask 5 times in between rooms, for which there is no scientific basis, that this is safe. We're absolutely terrified.
Some nurses here chose to remain anonymous for fear of repercussions, but many are feeling desperate as they've been isolated from their loved ones.
I live by myself. My boyfriend is able to self-quarantine in a home with his children, but I can't see him. My mom is 80 years old and I can't deliver food to her because anything that I touch could potentially contaminate her. So we're relying on other sources to have my mom fed.
Marcia Santini has been an emergency room nurse for 32 years. As a representative of the nurses union, she's been vocal about some of the most sensitive issues her colleagues are grappling with.
We always put ourselves last. So if it means being isolated by yourself, so be it. Is it something that's not weighing on us? Yeah, it is too, but we'll do what we have to do. Many of us haven't been sleeping, having horrible nightmares, because it's on our mind all the time.
Others are worried about their care for patients being compromised while they comply with COVID-19 measures in critical units like labor and delivery.
When a baby in the course of labor becomes distressed, minutes matter as far as getting mom back to surgery so we can get the baby out safely. In this time, now we have to put on PPE, we have to put on the mask, the gown, the gloves, all the things. It takes up to 3 to 5 minutes to get everything on. That's time delayed for patient care, and that's a huge concern because now we could potentially be risking the well-being of a child.
Hundreds of hospital workers have already contracted the COVID-19. At least 175 at UCLA alone, according to the Los Angeles Times. But many are still not getting tested.
The answer we get is if you don't have symptoms, you don't need to be tested, and we don't have enough test kits to test everyone. And also another concern is that when you are tested positive, you'll be put on quarantine for 14 days. And if your symptom improves, then you can go back to work. We believe people should be tested negative before they return to work.
Despite all the risks involved, these nurses continue to provide the much-needed care for their patients, and the sacrifices they make aren't going unnoticed. It is Tian Shan, CGTN, Los Angeles.